Hello, listeners, and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science.
Hello, and welcome to Beyond the Mirror.
Fulfilling life.
Today we're
Sit back, relax,
very excited. I'm
join us
very
as we
excited
go
to
beyond
have my acupuncturist here with us. I'm excited to be here. She, to me, has been a life-changing person. I suffer from pretty chronic back and shoulder pain from my job of working on people's faces for 23 years, and she has really helped me with acupuncture and cupping. I love cupping.
Mm-hmm.
And I never thought I would. Like, that just seemed like absolutely not. I would never like it.
Did it seem weird?
Yeah.
Yeah. Which
Like,
I'm
what?
fine with. I do weird things, but yeah, I'm so glad I've helped you. And in all honesty, like in my practice, I see a lot of people with chronic conditions that just need help. And that's why I love what I do.
So why don't we start by, how did you get into this?
Okay.
What brought you to this profession?
My long story long. So essentially, I had a lot of health conditions when I was younger. I had a lot of digestive issues, a lot of back pain. And of course, I did what everyone else did, went to the doctor, then went to a specialist, and then ran all these tests. And then they came back and they said, well, you're normal.
Mm-hmm.
And they just let me, leave the office, no recommendations. And yeah, so of course I was frustrated. And my mom, of all people, was like, well, let's try other things. Let's try a chiropractor. Let's try acupuncture. And that just totally changed my world. She talked to me about food. My digestive issues were like bothering me. And no doctor was like, let's try to eliminate foods. Let's, look at what you're eating every day. Just the basic things that could affect my digestive tract weren't even a conversation. So yeah, my acupuncturist had those conversations with me and it changed my life.
Awesome. And for those who don't really know what acupuncture is, can you kind of explain to them what it is, who are, for those that are unfamiliar with it?
So it's funny because it's like, I always ask people, like, do you want the woo-woo version or do you want the sciencey version? Like, what do you want to hear? Because there's just so much history and there's so much about acupuncture I could tell you about. And, I am a mixture of like science and woo-woo. So I like to go back and just say, first of all, like 3,000 years ago, when they were essentially figuring out acupuncture and Chinese medicine, they were doing sciencey things. They were the first people that were using cadavers, and they were looking at the nervous system, and they were just seeing patterns with our nervous channels and pain and how it can affect our mood, our hormones, and things like that. So it really started off as a big science experiment that has made the most like complicated and coolest energy medicine there is today.
Yeah, and it's completely different than like Reiki or other types of energy work. You were like really touching and making contact with and understanding the meridians of the body, which again, for a lay person, I find completely overwhelming and confusing. But like, can you kind of elaborate how that's working? Like what's happening in like when you're using the needles in specific areas, what's happening with the body?
So, whenever someone comes to get acupuncture, first of all, they tell me what's going on with their body, and then I sit down and I listen to their body. And so I'm feeling their tongue, I'm feeling abdomen, I'm feeling muscles and meridians, and looking at the tongue to kind of decide what needs to be moved, what needs to be strengthened. And then I'm using points based off of that. So that's my like generalized version of answering that question. And of course it can get really complicated because, in Chinese medicine, we have all the same organs that we talk about in modern day, such as the kidney and the liver, but then we have the channels that go to them. And then we also have extra meridians and extra points that can treat just like muscle pain. So it's a very advanced theory that really could go in many different directions. I actually went to school and got a master's in Chinese medicine. So I spent 4 years studying the different types. And there's Japanese, there's Korean, there's, of course, you guys have heard of dry needling that chiropractors and physical therapists do. And I do basic TCM, which is traditional Chinese medicine. So I base everything, like your treatments, off of traditional Chinese medicine.
So that's also a confusing topic.
I know. I feel like, it's kind of hard because if you think about it, I am explaining like a different language to you guys. So it's like, how can I explain this in layman terms that everyone can wrap their mind around it? Because, it's not like we went to school and when we were studying biology, we were talking about these things when we were 7 years old. So it's like, it's kind of hard to really describe it so everyone can wrap their mind around what I'm saying, if that makes sense. And of course, I can clarify anything if I need to.
Sure. So in your practice, you have some particular focuses, like what are you fixing a lot of the times? I mean, obviously pain.
Yes. So I am probably doing mostly fertility. Just because that's been like a personal project of mine. I had infertility for, pretty much my whole life. I unfortunately just had endometriosis at a really young age. So I see a lot of infertility. I also do a lot of skin stuff. I actually studied in Taiwan 10 years ago, which seems weird to say, but 10 years ago. And I worked at a clinic that specialized in skin. So I do a lot of skin stuff. And that's also something I really love to do. And then, of course, I see a lot of anxiety. I see a lot of migraines because we're in the Midwest and our barometric pressure is so up and down here. See a lot of dizziness.
Well, so yeah, that's interesting on the fertility front, because that is an increasing problem in the United States right now.
Yeah.
And so that is probably keeping you quite busy.
It is. I think just 5 years ago, the statistics were 1 in 8, and now it's 1 in 6.
That's tough.
Mm-hmm.
Yeah. And 5 years for that to change that much, obviously something has changed in our environment to cause that.
Well, and the other thing, when she's talking about face, she does like a Botox acupuncture.
Yes.
I was going to ask about that. It sounds so cool. Tell us a little bit more about that.
So I do cosmetic acupuncture, and essentially, I can focus on wrinkles, sagging skin, but I put a lot of needles in the face. Just warning there. But it works. And honestly, a lot of those points in the face also like relax your brain because it's right near your brain, So there are people that have come in that are like deathly scared of needles. And I'm like, giving them that warning, like, hey, I'm going to put a lot of points in your face. And of course they're scared. I do it. And then I leave the room, I come back and they're like snoring, which is so funny.
Wow.
Yeah.
That relaxed. That's amazing.
Yeah.
So I kind of want to have you explain, because you've done a little bit of it, of like how your assessment kind of goes. What would someone expect when they come to see you?
Yeah, good question. So I would say definitely, the first time you sit down with the acupuncturist, we usually do like a full medical consultation and go over every symptom in your body, because we really treat the body as a holistic, like essentially like the body as a whole. Mm-hmm. So one symptom of like your digestive issues could totally be related to your headaches. So we're just asking every question to kind of figure out what's going on in your body and what do we need to treat. And then, of course, like I said before, I go into feeling, the tongue, or looking at the tongue, feeling the pulse and that kind of thing before we do the treatment.
And then how long does somebody usually stay with you? Because it's usually not a one and done. Okay, now I'm painless, I'll see you later.
Yep.
So kind of give us a feel of like how that works.
Well, I'll say that can happen too, which is really cool. I've had many women that have like tried getting pregnant for 2 or 3 years, and they come to see me and bam, they're pregnant after one treatment.
Awesome.
I've also had people come in with severe pain and I treat them one time and they're totally better. I can even tell a story on that if you want me to, but
Yeah, that'd be great.
but the normal course of treatment is you do want to come back. Oh, there goes my earring. 6 to 8 times. And you'll notice that every time you come back, your symptoms improve more and more. So yeah, that's the general, course of treatment.
Awesome. And tell us the story.
Okay. So I tell this story a lot because it was like one of my first patients. So of course you remember it the most, So I had this woman come to see me who had headaches every single day. And she was a little bit older. And as I'm sitting down to do this, her consultation, she's telling me about the shoulder pain that she has. And then I'm like, okay, well, tell me why you have the shoulder pain. And she told me that she had breast cancer 10 years before. And of course, they did the chemo and the radiation. And she's like, and they did radiation right here. And she pointed to a spot. And I looked at the spot on her shoulder and I felt it, looked at it, and it's just the coloring was wrong. It felt weird. So, I did one of our things. It's called gua sha, where we use like a soup spoon to like scrape, the skin to like release toxins. And I was like, I'm going to scrape this area because she had radiation there and I'm going to release the toxins of that. So I did that and it was gnarly purple green. It just looked awful. And of course she was older and she had really thin skin. So I'm like, oh, I hope I didn't hurt her, So I do the treatment, she leaves. And of course, in the back of my mind, I'm like, did I do too much? Is she okay? And so she, didn't come back to see me until maybe 6 months later. And of course I was like, oh, thank God I can make sure I didn't hurt her. She comes back 6 months later. And I was like, and she comes in and she's like, well, I have this hip pain. And she starts telling you about the hip pain. And I'm like, but wait a minute, how about the headaches in the shoulder? And she's like, oh yeah, that went away. And I've never had any problems since. And like literally she came in, had headaches every day for 4 years. So yeah, one treatment and she was better. And of course, in my mind, I'm like, did I do too much? Did I hurt her? And she was feeling great.
That is so awesome.
Yeah.
Those are the best. Like when you have those like really great success stories, like that's what makes you come to work every day.
It is. I'm sure you guys have those too.
Mm-hmm. Yeah, for sure.
Absolutely.
For sure.
For someone who is not familiar with acupuncture, are there any risks associated with it?
Yeah, there can be some risks. So, if you have blood clotting disorders, I think being careful about the cupping and the acupuncture and just making sure that you're with a provider that's just comfortable with those, diagnoses before you're getting a treatment. If you are pregnant, I would say making sure you're with someone that knows about prenatal care. But besides that, I think anyone can do acupuncture.
So mostly just clotting as a potential risk. And so you can treat a pregnant woman though?
Yes. Yeah. Okay. And I do that a lot in my practice too.
And then, so I've even sent my son to you for treatment and he was all excited because it's very cool right now with athletes.
I love that.
To do both cupping. I mean, you can see NBA players with cupping marks all over their backs playing basketball. And like, it's become very accepted practice in the world, which is so cool. I love it when something unique and different becomes normal.
Yeah.
For normal people. But I do think people, when I talk about getting acupuncture, the needle thing does come up.
Yeah.
Mm-hmm. And what I always say is I don't like to be poked. Like I actually would, if you poked me in the rib, I would be more mad than if you slapped me on the back. Like I'm not a fan of that, but for the most part, it's like you hardly feel it. The only time I do feel it is when you hit on something that I actually really need you to hit on.
Yes.
And it's crazy. She's done this thing on me where she will release these muscles, and these muscles on me and my shoulders and my neck are a mess. And she'll literally I can feel the muscle go.
Release the energy.
It's crazy.
Yeah, it is awesome.
It's so crazy.
Yeah. And, I'd like to touch on how sometimes during a treatment, when I'm treating you, you do get a point where you're like, whoa, you really feel it. But even when you're feeling it, would you describe it as painful? Sometimes, yeah.
But not the needle. It's not the needle that's painful.
It's the sensation, right?
It's whatever's happening underneath it.
The microfibers.
Where my problem lies, then that's where the sensation is coming.
Yep. And I'll also say that sometimes even when we work out, it's painful.
Oh, yeah.
Sometimes doing things to the body that's good for the body is not always a feel-good thing. Even a deep tissue massage is sometimes painful.
Oh, sure.
But I think like not being fearful of the sensations that come up when you're working on the body is like a big thing too. Because, I think like we, as children, we would like go get shots from your doctor and like literally they just bend you over and throw the needle in and like, it's pretty awful, right?
Yeah,
like
it's traumatic.
So of course we assume that like every other thing with the needle for the rest of our life is going to be like that. And
I do think a lot of people associate that from their early childhood relationship with the doctor, the nurse, or whatever, who's, doing whatever on them when they're younger. There's 100% an affiliation there. Even when we're doing Botox and filler.
Oh, yeah.
Yeah.
Sure.
Yeah.
And they're choosing to do that. They're choosing to do acupuncture, but there's still that like apprehension. And it does like activate in some people that vagus nerve, which is actually something else we're going to be talking about in an upcoming podcast. So stay tuned. I do also want to hit on, like you had talked about having a master's in Chinese medicine. And I really, like something that was important for me today was for you to address, like I want to gently address, like my chiropractor. I love my chiropractor. He's very smart. He's very good at what he does. And he did like a weekend course in acupuncture, and now he's doing acupuncture. To me, that is just nowhere near the level of education that you had to do what you're doing. And I say this because, what is it, like the majority of people doing acupuncture are in the first category of the weekend.
Especially in the state of Missouri.
Yeah.
Because there's no acupuncture schools here. So yes.
And so people really need to investigate further. Like, how did they learn that? Where did they get their education? Like, again, how much time have they spent?
Yeah.
But I feel like after experiencing it done properly with you, I couldn't even consider seeing someone else.
Yeah.
Yeah. And I think too, I've talked to a lot of people who have had acupuncture, and the consensus is like either they love it or they hate it. It's not like a gray area. It's black or white.
Yeah.
And I really do think that it has to do with the practitioner. And
yes.
Yeah, I really do.
I just had a client last week who had only experienced dry needling from a chiropractor. And when she came to see me, she was literally almost shaking to try, like, because she was so nervous, but she really wanted to try it because one of her close friends had seen me. And so, of course, by recommendation, she was trying it for a friend.
Overcome her fear. Yeah.
And I did the treatment and she was like, oh my God, I'm never doing dry needling again. I'm only coming to you. And, that being said, I actually do dry needling, but I think there is a difference between someone who has taken a weekend course and someone who has done a full 4 years of studying it. And, also people go to chiropractors and feel better all the time when they get acupuncture. So I don't want to belittle that in any way.
100%. 100%.
But if you have had an experience with a chiropractor where you've gone and gotten acupuncture and it didn't work, there's a reason for that. Yeah. Like they really, in a weekend course, they're learning the basics of like how to treat a headache by using one point. And the thing is that one point isn't going to treat all headaches.
Right. Yeah. Do most of your clients that you're treating notice a shift after?
Yes.
Okay. That's great to know.
Yeah.
I've had people say, I didn't notice anything at all. And I've actually had acupuncture where I didn't notice anything at all. Not from you.
Well, okay. And it's funny because like one of the things I love about treating skin is like you see it. you know?
So cool.
Kind of like Botox, right?
right, yeah.
You get this like instant gratification of like, you know, the wrinkles are gone, the skin looks better. And with pain, a lot of the time it's the same, where it's like people are getting off the table and feeling better. Even if it's not 80% better, it's usually 20% better.
Yeah.
But there are times where people have what I like to call like a slower healing time, or they just process things a little bit slower. So I can do a treatment. They can feel the same getting off the table, but really wake up 2 days later and be like, oh my gosh, my leg feels better, or my knee feels better.
That's totally me. Like even when I get a massage and I get off the table, the massage therapist will say, how do you feel? And I'll be like, ask me tomorrow.
Yep.
Because I don't know. Like I get no change in that immediate step off the bed. But a couple days later, or even 24 hours later, I'm like, okay, now I can see the difference. And so, yeah, it definitely, and like, okay, funny question. Do you think men are less perceptive to the change than women? Because I feel like I think they're less perceptive to change in other ways.
Yes. I mean, you know, like what is it, like what we used to say, like a man's arm really has to fall off before he's like going to the doctor.
Yeah.
Like I think they're kind of not in touch with their bodies as much as women. And I'm not also saying that to belittle men, but they're maybe taught that, you know, like when a little boy cries when he's 7, he's told, don't cry, keep going, you know,
power through
it. Don't get in touch with your emotions right now. And so I think, you know, then they do that for years and years. And then when they're adults, like, of course they're not in touch with their bodies and what they're feeling.
Yeah.
I also wanted to touch on Botox because I have a question for you. Okay. So, and this is like going back to the whole needle thing. So you don't really give Botox, but I'm sure you've like many times seen.
She does.
Okay. You give Botox.
Yes.
And the first couple times people get Botox or fillers, like you see the nervousness in them, especially if they're scared of needles. And don't you see that fade over time? Yeah. And that's the same with acupuncture. Like even someone who's super scared, I don't know, it like the more you do it, the more comfortable you are with it. It just becomes easier. You know, when we do anything new, it feels uncomfortable.
Well, because you don't know what to expect.
Correct.
Yes.
And I think it's true of any kind of needle.
Yeah,
Even when we do
100%.
IVs, when we do injections, it's with any needle.
If we do micro needling,
yes,
people are apprehensive because the word is in there. You know, like, oh my gosh, what does that mean?
Yeah.
And then by the third micro needling, they're just laying there like, just do it deeper.
That's right. hit me more.
Get rid of this wrinkle right here.
Lift this up, please. So yeah, definitely.
Absolutely.
So are there pieces of advice you can give to people? Let's start with fertility, since that's an expertise of yours. Like outside of acupuncture, have you found things that help with fertility if that's someone's battle?
Yeah. So I guess I get a little more, we'll say functional medicine when it comes to fertility. And I tend to recommend a lot of supplements, and I would say making sure you have the essentials. So, you know, starting with a prenatal before you're trying, making sure that your vitamin D levels are good. If you're having inflammation in the body, doing things for inflammation. So I like to recommend fish oil. You know, fish oil has been researched with infertility quite a bit. And so it's vitamin D. So those are my go-tos. Also, I'll say something weird about Chinese medicine, that when infertility comes up, we usually talk in terms of like cold and damp and heat. And I'm sure you guys have kind of heard those terms before. And what we don't like is the uterus to be cold. So we actually do not like the crop tops that everyone are wearing right now. Like we don't want the abdomen to be cold. We want it to stay warm, and we want the uterus to be warm. And I know that's like such a grandma thing to say, right? I feel like someone from the silent generation being like, cover up your belly. But you know, in Chinese medicine, we do see that as something that's really important. So I would say, you know, keeping your body warm so your blood circulation's good, not only to like your feet and your hands, but all your organs in your body.
So how do you feel about like infrared sauna and that mix of things?
Love it.
Okay.
Love it. Yeah.
And then what about pain when you're dealing with someone with pain?
So I also take that kind of functional medicine approach where I'm like, are we working on, decreasing inflammation in the body, then incorporating supplements that do that. And of course, I'm really into turmeric because that is a Chinese herb. And then if, you're needing more blood circulation or lymphatic circulation, I'm all about, of course, acupuncture, cupping, massage, doing things to move the body can really help with pain.
Yeah, like we do full body lymph drainage here. We do facial lymph drainage. But she also does, when you have inflammation, Dina has this great system of inflammation reduction, which is a whole detox situation where we're just pulling the things out that are just causing that fire in the body.
Love that.
Yeah.
Love that. And, also we can get into autoimmune because that's just totally a different ball game when it comes to pain. It's a whole beast.
It is.
Mhm.
Really
because usually there's inflammation and blood circulation issues and something else going on. And there can be a viral load that's, latent in the body. There's a lot of different things that come up.
And the increase in autoimmune diseases, it's through the roof.
Oh my gosh.
And in children now.
Yes.
yeah.
Yes. Yeah.
Through the roof. At what age do you generally find it comfortable for you to be working? Like, how early will you work on someone?
I've seen as young as 2. And usually when I'm seeing a kid, I'm not really putting tons of needles in their body because, think of a 2-year-old.
They're small.
They're small. They're all over the place. They're going to cry. So I spend a lot of time just like doing palpation and massage with them, essential oils on points, maybe doing 1 point for 5 minutes. Because kids actually do have a really, they're generally born with a better immune system. Yes, I agree. Autoimmune is really popping up more and more. But yeah, I've seen as early as 2, but I don't really specialize in pediatrics. I definitely see a lot of teenagers. Teenagers love me because I don't have children. So I'm like instantly cool with them.
That's awesome. Well, the other area of acupuncture that's become pretty popular, I think, is animals. Like I've had a ton of clients tell me about their dogs getting acupuncture.
Yep.
I'm sure you don't do pets. Do you do pets?
I want to so bad. I've actually tried on Rosie, who's here in the podcast. She's sitting in a chair behind me, but adorable. I tried on her when she was a puppy a couple times, and of course, just like a child, she just moved all over the place, and I'm like, this is not working.
So my one client that has done it regularly for one of her dogs has a chronic illness, and this really works on him. She says it's crazy when the pet acupuncturist does it, the dog immediately relaxes and remains still until the needles are removed. And I'm like, oh, how do they do that? Right? That's so cool. Like,
it's like the dog knows.
I do think that. And they also don't know the placebo effect. It's not like, you know.
Yeah.
They're just responding to acupuncture, which is amazing.
Right. So cool.
Right. And then like we were discussing the other day, like I was reading recently about kind of how our bodies are electrical conductors.
Yes.
Because we're mostly water, and water is one of the best conductors of energy, electricity, etc. I was reading that acupuncture is actually communicating with that system in our body as well.
100%. So when I'm putting a needle in the body, I'm really working with our energy, which we call chi. And the thing is, I don't use that word tons because I feel like I do kind of lose people at that.
It's a little woo-woo.
It's a little woo-woo. But, in Chinese medicine, the chi carries the blood. So, I use the word blood a lot when I'm talking about moving things in the body because people can wrap their mind around it. But my belief is really that chi is moving the blood.
And then how do you, there's so much science. So I want to absolutely say to those listening who are skeptical, the amount of science around acupuncture is through the roof.
Oh my gosh, especially outside of the US. There's a lot of research that's being done now, but in Europe and Asia, there's so many research studies. And one of the coolest research studies sorry, I'm interrupting what you were going to ask me.
No, that was what I was going to ask you.
But one of my favorite ones was they actually did some research on acupuncture points in the body, and they found that a lot of the points are at the proprioceptor of the muscle, which has the most nerve endings. And they've also found like a larger amount of, we'll just say, oxygenated blood at those areas, which I just found so cool because these points were found 3,000 years ago.
It's fascinating.
And then they're researching it now and finding that at these points. Like, how cool is that?
That is so cool.
Yeah. So yeah, the old can become new.
Yeah.
There is a lot of that in science right now, though, the verification of old practices and ancestral practices and stuff that are showing all kinds of legitimate science.
Like breath work and yoga.
Oh, yeah.
Yeah.
I mean, honestly, I always get like a little giddy when I see stuff like that. You know, I remember, you know, in the 90s, like it was really trendy to research food, which I feel like they don't really do that anymore. They should, right? I mean, that's what we're putting in our body every single day.
We've done like 12 podcasts.
Yeah,
on
I
that,
know.
Yes. Like that is like how we can empower people the
fuel.
most.
Yeah.
Yes. Yes.
Mm-hmm.
And, you know, like
That's my jam.
yeah, totally.
I love it, yeah.
Totally. And like when research comes out that they're like, garlic is fungal.
Parasitic.
Yes.
Mhm, yeah.
I'm like, thank you, because we've been saying that.
Ginger. Yes. I know.
Well, even like with turmeric. So it's funny that you bring that one up because you mentioned that one as a herb that you recommend. So for me, I'm actually estrogen dominant. I'm highly estrogen dominant.
Uh-huh.
And turmeric raises my estrogen.
Oh, interesting.
Which is not good for me.
Yep.
However, it's great for someone having low estrogen issues.
Mm-hmm.
Like, and it could be that's how it's helping someone.
Yes.
And that's not always how it works. Like, I'm just a weird anomaly. Like, if you give me something, I'm going to totally react different than everybody else. Like, if you give me Benadryl, I'm going to be hyper instead of sleepy.
She's not wrong. It's with everything.
But, you know, there is something about that turmeric root that is, you know, can help with estrogen, balancing estrogen and all that. So it totally makes sense to me that.
I almost wonder if you did a little more licorice root with the turmeric, if that would balance that out. Not that I'm telling you have to try it.
I'm just sitting waiting for menopause.
I'm
Just letting you know, like where everyone else is like, no menopause. I'm like, please bring it on. Let's make this happen. I'm ready.
Most people are not saying that.
So anyway,
but estrogen dominance is uncomfortable too. So I totally get that.
Yeah. Is there anything else that you want to like hit on that you've missed?
Like, are there any emerging trends or advancements in acupuncture that listeners would want to be aware of?
You know, I guess I can just kind of talk about dry needling just for a second, because I do feel like that's super trendy.
Mm-hmm.
And, you know, I was kind of not wanting to belittle anyone that is getting benefits from it, but I'm just going to say this, that whenever you go in to do dry needling, what they're doing is they're putting like 30 needles in one muscle, which, you only have to take a weekend course to learn that, right?
Yeah.
But the thing is, you can't beat somebody and tell them to relax, you know? And that's what's happening with dry needling is they're beating a muscle and not treating the holistic person. So if someone's going through so much stress or they've had like some injury to a muscle, you can't just repair that one muscle. You have to think about
the whole body.
Yeah. And I think that's where dry needling's lacking. And I kind of wish PTs would come together and, you know, pretty much admit they can't do that and work with acupuncturists, but that hasn't happened yet, you know. But yeah, you know, I just wanted to say that like if you've had dry needling and it hasn't worked for you, that's probably why.
That's good to know. Yeah.
Well, it's been fabulous having you. I've actually talked to you, you know, for a long time. Like every time I come to see you, I'm like, oh, I just want to be back because the conversation's so interesting. How do people find you if they want to come and see you, or you have another wonderful gal, Melanie, in your practice?
I do.
How can they find you?
So I'm at Golden Door, which our website is goldendoorstl.com. I'm in St. Louis, so I'm in Brentwood, Missouri, if anyone knows where that's at. Yep. And I have another colleague, Melanie, who can see people as well as me.
How do you recommend someone find an acupuncturist if they don't live here?
Great question. I think that you would want to Google a licensed acupuncturist. And, when you call, ask them, like, where did you go to school for acupuncture?
Right.
And there's your answer. They'll tell you, like, I went to acupuncture school or I went to chiropractic school. So, yeah.
Okay. All right.
Awesome.
Did I miss anything?
No, I've totally enjoyed having you here. So
Yeah,
thank you so
so much.
And for our listeners, be sure to like, subscribe, and share. We appreciate you listening, and we look forward to seeing you on another podcast.
We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health-related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new health regimen. Remember, your health is your responsibility, and it's always best to consult